weekends may be good for your heart health. A new study found looking at hundreds of thousands of people that those who sleep in on their days off were about 20% less likely to get cardiovascular conditions such as heart disease. So what does this mean for you and your sleep habits? I'm joined by Dr. Navina Mehta from Greenville Sleep Clinic. So thank you so much for joining us today.
Yeah, thanks for having me again.
So what did you think of this study? I feel like it's not necessarily what doctors tell you. They don't say just make up for it on weekends. Normally they say try to set up a routine throughout the week.
Completely. So I think it was a very interesting study done out of the UK, so we don't have anything like that here in the United States yet. But essentially what it covered was adults between the ages of 40 and 69. They studied about 500,000 patients. And what they found is that people that get to sleep in on the weekends, if they have a sleep debt during their weekdays, showed a 20% decrease in cardiovascular risk. Am I a fan of this study? Not entirely. I do think having a sleep hygiene, a sleep routine throughout the week, actually every day of the week, is incredibly important.
So what do you mean by sleep hygiene?
Yeah, so it's how you approach your nighttime routine, right? So when you wake up, you do certain things to start your day. So what do you do in the evenings to start your nighttime? You know, do you quiet the area down? Do you dim your lights? Do you avoid screens? What do you do to get ready for the nighttime?
Okay, it's like I have a year-and-a-half-old son, and we have a routine, you know, so adults should do it too.
Absolutely, yeah. So, you know, between sleep, nutrition, and exercise, those are the pillars of a healthy lifestyle. And I think a lot of people don't understand that sleep is incredibly important to the recovery and repair of your body, to your brain health and your heart health.
Need at least 7 hours, right?
7 to 8 hours in a 24-hour period, yeah.
Now, I thought it was interesting, we were talking about cardiovascular disease. So why does that play a role in your sleep habits?
Yeah, so, you know, sleep is important for recovery, like I mentioned, and 7 to 8 hours in a nighttime is ideal for most individuals. It's when the brain gets to kind of shut down and the body repairs itself, including your heart. And so if you're not getting enough sleep, that's stressful to the heart, and that can lead to things like hypertension, heart disease, different arrhythmias. AFib is a common one, and insulin resistance is another one, so diabetes. So there are a lot of studies here in the United States that associate poor quality and quantity of sleep to heart disease.
Okay, so bottom line, sleeping in on weekends, I guess it's better than nothing.
It is. It's something, yes, but ideally every night you should try to aim for the same amount of sleep.
Yeah.
Yeah.
All right, and it's good for your heart health, so keep that in mind. Thank you so much for joining
Yeah,
us today.
thank you.
All right.